Good morning, everybody, and sorry for that technical hitch. I'm Lucy Peake and I'm the Chief Executive at Kinship, and I'm delighted to welcome you to this webinar where we will be sharing our findings from our annual survey. I'm delighted to be co-chairing today's session with Sinead Warren, who is a kinship carer for her niece and also a project worker supporting other kinship carers in London for Kinship. Sinead is one of 9 kinship carers who work for our charity now. And I'm absolutely thrilled that 20% of our staff team are now kinship carers. They bring such incredible richness to all of our work, and you'll be hearing from lots of them today. Sinead will now introduce the speakers and the format for the webinar.
Thank you, Lucy. I'm delighted to be here to share our survey findings with everybody. We had over 1,651 responses from kinship carers caring for 2,538 children, the highest number of responses ever for our annual survey. So thank you for everybody who've responded. We're going to be sharing the findings in 2 parts. First, Paul McCarthy, our policy and practice advisor, will look at the needs of children in kinship care. And second, our research and policy assistant, Lorraine Ashley, will focus on support for kinship carers. We'll also hear from 2 of my project worker colleagues at Kinship. That's Vicky Elwoods, who was a kinship carer for her 2 nieces. She supports kinship carers in RCT and Mirth in Wales. And Kelly Taylor has an SGO for her nephew. She supports kinship carers in Bradford. Well, there'll be a mixture of research, presentation, and discussions. Please use the chat function to share your thoughts, any ideas you have as we go along. I'll hand over to Paul, who will introduce the survey findings. Thank you.
Hi, everyone. Thanks for coming today. I'm really pleased to be here to be sharing this year's surveys. So, sorry, I'm just having, okay. So just to begin with, just to reiterate what Sinead said, really, I'm really excited that we had such a large response rate. We had over 1,600 responses for carers caring for over 2,500 children. That is huge. The full report is on our website, so please go and have a look at that if you get the chance. So just to begin with, just to consider the details of the carers, there was nothing really surprising in what we found here. It's things that are being identified constantly in research into kinship care. So nearly 2/3 of carers were generally older than mainstream parents, between the ages of 55 and 75. Obviously, that brings with it its own kind of challenges at times. 92% of the respondents were women. And again, that's traditionally the case. The most kinship carers are women. 71% of carers were not in employment, and that's quite worrying. And we'll talk about this a little bit later on, just about how that causes real problems financially for carers. And one of the reasons for that is because quite a lot of our carers, the respondents, were retired, so they were claiming pension, and it's hard enough trying to survive on a pension without having to be a kinship carer at the same time. So that could be a problem too. And just over 1/3 of carers were single carers, and again, that can cause additional pressure when people are having to raise children by themselves. There were some kind of more worrying statistics when it comes to the details of the carers and the respondents. So 93% of the people that responded were white, and previous research into kinship care has shown that about 32% of kinship carers happen in non-white families. So that's a real, there's a big gap there of people from ethnically diverse backgrounds not responding to the survey. And what that means is that their voices and their experiences are not being heard, and we're not able to represent them. So we need to do a lot more to engage people from different backgrounds. And just one other statistic that was slightly worrying was that generally we know that the majority of kinship carers are grandparents, grandmothers predominantly. However, we only had 7 responses from sibling carers. And that's, again, quite worrying because previous research has shown that nearly 1/4 of kinship carers can be adult siblings. So there's a real a real lack of understanding of what their experiences are like if we're not hearing from them. But fortunately, Kinship Care, at Kinship, we have a researchers network where we meet with other researchers. And if there's any researchers here that want to join that, please just send me an email. My details are on the website. But we have researchers that are looking into sibling carers. So that's quite positive, but we need to do more to try to engage sibling carers. So when we consider kinship carers, one of the things that come through quite strongly in the survey was that a lot of people that are caring for children have their own needs, their own support needs. So over half of the kinship carers responding said that they had needs that they wanted support with or they needed support with. However, only 13% were receiving that support. And a quote here from one of our carers kind of highlights that. And she says, "I have cancer and the child is hyperactive and very attention demanding. I'm on chemo, so exhausted." It just highlights that when people have additional needs, it's so much harder to care for children. And as I'm going to explain in a minute, the children that kinship carers care for often have their own needs too. So it builds on that the pressure that carers face. And this is something for anybody who come to the other webinar we've done earlier this year around finances and our financial survey, poverty, this survey has highlighted poverty continues to be a real issue for kinship care families. Just over a third of kinship carers believe they were financially able to meet them child's needs. So I think that's shocking. People take on children and they take on the full cost of the children, and only a third of them feel able to meet the needs financially. That kind of really does worry me. And 61% had worried about money in the last year. It's been a difficult year, and that's quite a lot of carers that are having to worry about money. And kind of, I think more worrying is that we see just under a third of carers, 29% said they had to seek financial support from friends and family. So they didn't have enough money to be able to cope by themselves. They had to seek support elsewhere. 13% of families had to rely on food banks. So they were worrying about money so much they weren't able to put food on the table for their children. And I find that shocking. And 14% of families had to rely on charities for essential items like white goods, like a fridge, a cooker, essential items, a bed, things like that in the house. So poverty is really, really, it's an issue. And we know that if people are struggling financially, it makes it harder to care for children. That's been shown time and time again in research. So when you the first thing we found when we was asking about children in kinship care was about the experiences that led to them coming into kinship care. Their experiences before they come into kinship care will have a massive impact on their development and their behaviour and how, while they're in care, and how they are to parent. So what we found was that the majority of children in kinship care have experienced trauma whilst in the care of their parents. Over half had parents that were involved in drug and alcohol misuse to such an extent that it meant that they were unable to care for the children. 49% had experienced neglect. Now, the research on neglect shows that children that suffer neglect are a lot more likely to have developmental issues and behavioural issues. There's also the children experience domestic abuse, they'd experience physical and sexual abuse. These are all issues that that cause problems for children's development. But what we do know is that for children that have had them experiences, the best therapy for any child that suffered trauma is to belong to a loving, stable, permanent family. And that's what kinship care can give. 96% of kinship carers believe the children were living with them permanently. So this is amazing. I'm a social worker by background. I've studied a lot in child development. This is so heartening to hear that kinship care can provide that for children. But not only that, what we asked this year, which I found really interesting, was were the children, what was going to happen to the children once they become young adults? Because in society, it's on the news quite a lot now, young adults don't leave home at 18. They don't, things have changed. Most young people stay with their parents until they're in their 20s, even 30s sometimes. 81% of our carers who responded to this survey said they were already planning to care for the children into adulthood. Only 2% said they weren't, and the rest were caring for very young children, and that hadn't come to, they weren't thinking about that at that time. And again, this just shows that kinship care isn't about just placing a child with alternative carers. It's about placing children in a family unit, and that family is similar to any other family where carers are committed to the children into adulthood. This quote really kind of sums it up, and I think it's really powerful. Is my granddaughter feels at home is with me, and she is happy to be here. We are a family. That concept, that idea of family, really come through in the comments that were in the survey. However, the children did have additional needs that come through really strongly. So 62% of the carers believed that the children they were caring for had long-term physical or mental health needs. That's a lot of people. That's a lot of that's nearly 2/3. However, only 1/3 of the children had received a formal diagnosis, and that left nearly 1/3 that hadn't. So that's quite worrying, because children who've had difficult experiences, it can lead to behavioural issues, attachment issues. So their children need a diagnosis. If they meet that threshold, they need that diagnosis. One of the reasons for that is it's a gateway to support. So if a child is diagnosed with an issue, there is support that comes with that diagnosis. So the kind of, when we asked people whose children had been diagnosed what difficulties they had, there's a complex range of issues that were being raised. So there was developmental issues like learning difficulties, autistic spectrum disorder or Asperger's, ADHD. There was mental health problems like anxiety and depression. And there were issues related to trauma, such as behavioural difficulties or attachment disorders. All of these conditions and all of these issues mean that children need a lot more care. They need a lot more understanding. The carer has to learn to manage the children, but they also have to support the children to manage their own difficulties. And that's such a complex thing. And we also know that carers need to be in the place to be able to do that. So the more support you offer a carer, the more support the carer is then able to offer the children. One of the reasons we think that there's so many undiagnosed needs in kinship care is that there's no legal right for kinship carers to ask for a health assessment for their children in the same way as children in foster care and adoption have. So that may be something that needs to be considered in the future. There were other needs that come out as well. So nearly 1/4 of carers had experienced child on carer violence. So that's really distressing for carers, but also that's really distressing for children. Children don't want to hurt their carers. I've worked with children that have suffered distress for years, and it's something that they find really difficult to manage themselves. It's really distressing, and it's distressing for the carer, who obviously doesn't want to be hurt. So that's something that's really worrying. 36% of the children had been diagnosed with special educational needs. That's 3 times the national average of 12%. And 19% of children's of contact had stopped due to COVID. So contact can be a very difficult issue for kinship families. But I think nearly 1/5 of contact stopping can have real consequences for the children. We also found that kind of all of these issues can lead to risk-taking behaviours being displayed. About 42%, so just under half of kinship carers reported that their children were displaying risk-taking behaviours, and that figure would be higher, I think, if we were focused just on teenage children. Obviously, the respondents were caring for a wide range of children, but these kind of behaviours really kind of come to the fore more in teenage years. So the issues that we saw was issues around bullying, children bullying or being bullied, self-harming, going missing, being involved in risky sexualised behaviour, attempting suicides, taking overdoses. These are issues that will have long-term impact on children, on their development. It can really be serious. So carers are caring, they're doing their best, but they're faced with some real significant challenges. So just to conclude, I think what's most heartening really is that kinship care offers children the opportunity to live in a loving family home for as long as they need. That is what children need. Children in kinship care do have high level of needs, and that's mainly due to their previous life experiences. However, kinship carers step in and they help and they take on that responsibility. And this week, Kinship Care Week, is a time to celebrate that, but it's also a time to kind of raise the issues that they face. Furthermore, the needs of kinship care children are quite unique, and they're often really complex because of the complicated family relationships they have. Often they're living with carers who are related to the children or have a relationship with the children. And that's very different to other forms of care. However, despite all of this, the needs of kinship care children are not considered in the same way as the needs of children with similar backgrounds, such as foster care and adoption. Children don't have the same level right to support. So kind of moving on for the rest of this presentation, it's really important to keep in mind that there is real hierarchy of support with kinship care children and their carers not receiving the same levels as other children. So I'll pass you back now to Lucy, and thank you so much for listening to me.
Thank you, Paul. I think those findings are such a powerful reminder that children in kinship care have additional needs, as you said, but unlike those children in foster care and adoption who have similar needs, their carers and those children are not getting the support that they need. So I think we're going to explore what this inequality in support that's provided feels like for carers. And I'm going to do that by bringing in Vicky and Kelly, who are both have been kinship carers and are also supporting kinship carers through our projects around the country. I don't know, for some of you, you might have seen that we had a feature about kinship care on BBC 5 Live this morning, where a kinship carer from Wales called Sharon talked so powerfully about her experience of seeking support for her grandson. And I want to start by talking to Vicky, who's our project worker in Wales, just about her experience of supporting carers and what that case sort of feels like from her perspective. So Vicky, do you want to just start off with what you've seen on the ground?
Yes, of course. Morning, Lucy. Thank you for having me along today. I think we can pull many examples from the people that we work with day in and day out where this inequality comes across. But I think Sharon's story is just so powerful. She experienced after a long fight of trying to get some diagnosis for her grandson for some additional needs, and she attended a paediatrician's office where they were in the middle of discussing the assessment, which they paid for privately, incidentally, because they couldn't get any funding to support them with it. And the paediatrician said, so can you tell me what order you have for your grandson? She said, oh, yes, we have a special guardianship order. And the doctor sighed and said, now there's a shame. If you had adopted him or if you had fostered him, then there's many routes that we could go down to offer you support. But unfortunately, due to you having a special guardianship order, we can't help you. How is that okay? How is that fair? Why should a legal order define what support is out there for a child? Surely everything should be based around the child's needs, not around a legal order that the child has no idea about. Sharon talks of, at that moment, questioning, did she do a disservice to her grandchild by entering into what she believed to be the best option for them as a family and him as a child in offering him permanency under a special guardianship order? But instead, what she's being faced with is a lack of support, a lack of funding, a lack of any channels to get what he is entitled to as a human being because of a legal order, and to question if you've done the right thing. When you have done the right thing, you've offered permanency to your grandchild, to your family. it's just out of this world. I can't fathom it. It doesn't make sense to me. And yes, we face things day in and day out where we are so shocked by the things that we hear, but this today is just heartbreaking, shocking, and I'm sure that these are the stories that we can look at. This isn't an isolated case, but it's awful, and Sharon isn't on her own with this, but she shouldn't be called into question the actions she's taken with the best interest of her grandchild and be faced with that as an outcome. It's just shocking.
Thanks for sharing that, Vicky. And I just want to acknowledge that Sharon is on this webinar, so she is listening to this. And I want to thank Sharon on behalf of everyone at Kinship for sharing that story on national radio this morning, because it is truly, truly shocking, and it really brings it home to us all how we are disadvantaging already disadvantaged children because the system is so unfair. There is so much inequality in the system that is denying our children in kinship care the support that they need. And I do, I remember Sharon's words from this morning as well about battling, and there's so many carers who talk about battling and fighting, and really, that when you're caring for children who need lots of your time and lots of your support, to be forced into poverty, as Paul said, and to have to deal with that, and then to have to keep bringing yourself up for the fight to get the support the children need is just wrong. It's not something that we're expecting foster carers and adopters to do, but we do force kinship carers into that situation because the system is not structured properly. So thank you, Vicky, and thank you, Sharon, for sharing that story on national radio this morning. I'm now going to bring in Kelly, who works in West Yorkshire, really just to reflect on another key finding from what Paul's presented, which is that 36% of children in kinship care have got special educational needs, which is 3 times the national rate. And Kelly, I know that you work a lot with the virtual school in your area, and you've worked a lot with carers to try to get them the support that their children need in school. So I just wondered if you want to just reflect on a case that you've helped and what difference you've made and what needs to change.
Yeah, morning, Lucy. Thanks for inviting us. So there's lots of carers that we meet that have this issue. One in particular, a young man going into high school. He had an educational healthcare plan in place. However, it wasn't up to date. And the high school initially thought everything was fine, felt they could meet his need, and then he started to spiral. He wasn't managing, as we were already aware with his educational health plan that he wouldn't. And instead of their lack of understanding, really, so instead of sort of helping this young man and supporting him where the need was, they isolated him within school. So sort of a centre within the school isolated him away, and this had a knock-on effect on him emotionally and academically. And this went on for almost 2 years. And he was either isolated within the centre or sent home and excluded. So really, really having an effect with him. And we watched, trying to support and advocate for his sibling carer, watched for almost 2 years, his mental health, which he was already struggling with, sort of deteriorate even further from there, which was really, really sad to see. And we get this all the time. And I know how you mentioned the virtual schools, that we do work really closely with them in West Yorkshire. So there is that glimmer of hope that, schools can go to virtual schools for support. They initially worked with foster care children, but they've now got the remit to work with any child that's ever had social care involvement, and they can help a school, understand the trauma. The problem, I guess, what we see a lot is the schools see the child as being in a permanent placement, and then they assume that there are going to be no struggles along the way. They don't take into account, as Paul was saying, the neglect and how that affects these kids. So virtual schools can support not only the child, but they can support the school in training as well. And a lot of schools do take up sort of trauma training to be trauma informed, but it's kind of almost like a tick box exercise where maybe the head of school or a designated teacher might take this training. It doesn't feed down to the rest of the teaching staff. So it's not a whole school approach that they're having. So it's ineffective, really. And I guess what they need to do is be looking at it as a whole school approach and making sure that every teacher within school is trauma informed and trained, and they have an understanding of what these kids' needs are.
Kelly, and I can see lots of people are sharing their own struggles to access support. What I would say is do get in touch with our advice service. So you can, if you go on the website kinship.org.uk, there's information. You can contact us by phone, by email. Please do get in touch for some support if you need it. I think, you know, for me, what that whole section reminds us, and the case studies that you've just shared with us, is that we really need to equalise support for children who aren't being raised by their parents, whether they're in kinship care, fostered, or in adoptive placements. They have had similar experiences and they all are likely to have additional needs. It should not be about legal order. We should all be able to get support that's needed quickly. I think, Kelly, the example you talked about really says to us, let's not put those barriers up. Let's make sure that kinship carers can access the support that their children need quickly. This is about doing the right thing to promote really good outcomes for this group of children. So we do need a radical shift in the way that support is structured in kinship care. So thank you everybody for that section. Thank you to Paul and Kelly and Vicky. I'm now going to introduce Lorraine, who will present our findings on support for kinship carers.
Good morning, everyone, and thank you so much for joining us this morning. So Paul has spoken about the carers who responded to the survey and how they were often caring for children with additional needs. I'm now going to talk through what carers were telling us when we asked them questions relating to support. So I'm going to read out this quote in a second, and it really echoes what most carers were telling us that they wanted in support. And that was equality to what foster carers would get, especially with a financial allowance. So all support that would come with fostering as we do the same job, with more to put up with. We need therapeutic help, help with fighting for a diagnosis, more finance, more support, just a hell of a lot more support. So we can see this quote is from a carer who's cared for 3 children for over 10 years. So it really speaks to the expertise this grandmother has in being a kinship carer. So following on from what Paul said, the survey showed that the children had high needs. So it was very shocking to find out that 70% of carers had not received the support they needed from their local authority to help raise the children. So this has left under 1/3 of carers receiving support. What's even more concerning was that nearly a quarter of carers stated that the support they were receiving from local authorities decreased as a result of COVID. Again, this really speaks to the impact of kinship families being a vulnerable group and how unexpected world events can cause serious strain. What's also worrying is from this statistic, we're unsure if those carers still are faced with a decrease in support. Paul has also spoken about how in research, there has been a lot on carers not receiving support when it comes to contact. And that was evident in our findings. So nearly a quarter of carers had stated that they had not received support from local authorities to help facilitate safe contact with parents. So again, we have a quote from a grandmother, which really echoed what most carers were saying they wanted when it came to support from their local authority. So I believe that kinship carers are not really informed on the impact on their lives when taking on a child, financially, socially, emotionally, mentally. No information, no training. So we've also seen that over the past year, a lot of carers were under tremendous financial strain. So again, it was very concerning that just under 2/3 of carers had received a financial allowance. So when we looked at the responses, it was clear that there was a hierarchy in support based on legal order rather than the needs of the children. So again, this really built on the findings from our financial survey. So we saw that even though carers with SGOs were not doing so well, informal carers were doing even worse as they were not receiving a financial allowance. It was good to see that carers who had received an allowance, however, reported that they felt less stressed and were able to focus on the needs of the children. Caring for a child is expensive, and these carers are taking on full financial responsibility. As Paul said, a lot of carers are also sole carers. So again, it just speaks to the financial strain that carers are under and the importance of financial support. So we asked carers where they were receiving most of their support, and by far, friends and family seem to be the biggest support system. So 58% of carers received most of their support from friends and family. Schools were also seeming to build good support systems. So 52% of children had received additional support. So just under 1/5 of children did not receive the support they needed from schools. So this is something that is quite common in the survey findings, where we see some carers are getting support or a financial allowance. It's not universal to all kinship carers. However, if we are to compare schools to local authority support, we see that schools are providing better support. So we have this quote from a carer, which again, it just really speaks to the importance of a wider understanding of kinship care amongst professionals who work with kinship families. So that understanding can be applied into practice so that those professionals can help support kinship families. So the head teacher has one-to-one with our child. So she has someone to talk to other than us. Our Little One school is fantastic in supporting us as a family. So we also asked carers what type of respite would make their caring duties more manageable. And it really probed us to consider the language we use in kinship care. I'll explain in a minute. So nearly 1/4 of carers indicated that they never received a break from their caring duties. So we can see this quote from a carer that says, "We home educate permanently, not just during COVID, due to the children's additional needs. So the children are with us 24/7. So some carers were caring for children on a reduced timetable, children who have been excluded, or like this quote, children who are just not going to school. For those carers, caring then becomes a 24/7 job. This is impossible, it's unachievable, and it's even harder for carers who are caring for children with additional needs. So to a lot of carers, respite was merely the children going to school so that they could have time to catch up on day-to-day tasks. And the importance of schools in providing carers with a break was evident in our findings, as over 2/3 of carers found that when the children were at school, it allowed them to catch up on essential tasks. So carers just want that break during the day, like any other parent would get when the children are at school. Respite also emerged to be something that carers wanted to do together, so having a break as a family. So respite is not necessarily being away from the child, but being able to have a family holiday with the child would help all concerned. I love spending time with my granddaughter, so I would like respite for us together and to not be separated. So for a lot of carers, respite was a break from life and not a break from the children. Carers wanted a family holiday together where they could just not focus on the stresses of day-to-day living. Post-18 support is where we also found some very, very shocking figures. So Paul has talked to us about the permanence that these carers want to provide for children. So a lot of carers want to continue looking after the children once they reach the ages of 18. So it was very, very shocking to find that over 2/3 of carers were concerned with how they were going to continue caring for the children once they became an adult. And only 3%, a really low number, had been offered support for when the children reached 18. So very little is known about post-18 support in kinship care. No one has really thought to ask carers, but carers are committed. They have ambitions for their children. They want their children to go to college and to go to university, but they want that support to help their children on that journey. So the state should be equally as committed as these carers are to these children. It also begs to question, children in kinship care and children in foster care have usually had similar pre-placement experiences, but children in foster care have staying put guidelines. So if we really want the best for our most vulnerable children in society, we need to be improving their chances and not excluding them from support services. So all our recommendations can be found on the final report. However, our presentation has identified some key priority areas for us. So all kinship carers should receive a financial allowance equivalent to the minimum national fostering allowance. And we believe that this should not be means tested, and it should be paid until the children reach the ages of 18 or until they leave full-time education. Ensure every child in kinship care has access to the support they need. Again, with Paul telling us that carers are saying their children have long-term physical and mental health needs, but not all of those children have been given a diagnosis. These families need support. They shouldn't have to wait until they are breaking apart, until things get too hard. Children should have access to support. And lastly, a Kinship Care Act to enshrine the rights of children in kinship care and their carers. Again, I just want to say a massive thank you to every single carer who took their time to do our survey. All of this would not have been possible without you. Thank you so much.
Thank you, Lorraine. And as a project worker, I'm still very hopeful that, there's a lot of signs of local authorities investing in the support for kinship care, whether it's preparation for the role, the peer support groups, or improving financial support. But the survey shows support is still a postcode lottery. 1/3 of kinship carers aren't receiving an allowance, and I'm not surprised. I think from what we've heard from our kinship advice team, they're still helping a lot of kinship carers through financial crisis. Vicky, you're working in Wales. What is your experience working with kinship carers where you are?
Hi, Sinead. Excuse me. One particular family, lots of my families have financial struggles day in and day out, but one particular family springs to mind. She's a grandmother caring for a 13-year-old grandson. The grandson was previously living with the other grandparents under an SGO, a special guardianship order, and they were receiving a special guardianship allowance for him. Unfortunately, due to some circumstances outside of the grandmother's control, that was revoked, and he was placed with the other grandmother. She's a single parent. She's unable to work due to some health issues of her own. And the child was placed with her under a child arrangements order. The local authority paid no financial allowance to her at all, not a penny. She lives in a private rental property. That property is in disrepair, and the landlord is very slow, to say the least, at helping with any of those repairs. She finds herself living on the basic amount of universal credit. She doesn't qualify for any other benefits. Our advice service is supported with that, and unfortunately there's nothing else out there for her. They literally live hand to mouth. They use charities, they buy things secondhand from places like Facebook. They have just been lucky enough to be granted a grant that I applied for them, which has allowed us to purchase a bed for the grandson, a washing machine because they didn't have one and they were using a laundrette, but that's quite expensive, but she couldn't afford up to buy a washing machine herself. And we've also secured some money for some of the funding for things for the house as well. But she shouldn't have to rely on grants from charities in order to provide basic essential needs for a child that's come into her care at a time in her life when she didn't expect this to happen. And the local authority should step in and provide an amount, a non-means tested amount to every family in this situation. This isn't, again, an isolated situation that we talk about. This is day in and day out. And it isn't the same even within one local authority, let alone different local authorities or in England and Wales. And I mean, it's refreshing to hear that there are places in England now that are stepping up and starting to meet the needs financially of families, but it isn't across the board and it isn't enough. It needs to be everywhere. It needs to be equal. It needs to be meeting the basic, more than the basic needs of these children. These families are under immense pressure, immense stress, without financial burdens as well. And if we could reduce that financial burden, these carers could care more effectively for the children that are placed in their care and do the job that they're there to do, to care, rather than to worry. It's another element of kinship care that is just heartbreaking to see. And I'm sure you can agree, Sinead, it's something that we face as project workers day in and day out. And as carers ourselves, I personally have faced massive financial hardship when I was caring for my nieces, and I know that I'm not on my own with that as well.
Thank you so much, Vicky. Yeah, that's so true. And I'm sure you resonated with a lot of people in the chat as well. I can see so many comments of people just agreeing with all the points that you've made there. I'd like to bring in Kelly, the project worker who's been across Bradford. Kelly, do you want to talk about what's happening down in West Yorkshire?
Yeah, so we're really fortunate in West Yorkshire to have sort of the support that we've got. And financially, the local authorities, West Yorkshire is made up of 5 local authorities, and they're alongside Regional Adoption Agency, One Adoption West Yorkshire. And they are now levelling up their financial policies to bring them in line with foster care allowances, and then going forward, making them non-means tested, which is absolutely fantastic news for special guardians in the future. So it is, I'm very proud to be living here in West Yorkshire, and the support that they are leading the way with it.
Thanks, Kelly. And I'd like to say the same. I'm based up in West London, and there's been a lot of positive developments at both a local and regional level in my area. One of the big changes at the moment has been an improvement to the court offer of support available to special guardians to be more explicit in the support offered to them and the services. And while this is a start, there's still more to be done to be inclusive to all kinship carers. And again, just resonating what it was said a moment ago about the financial pressures on families and being able to support them so they're not having to go through financial crisis, and that we need a kinship care fair allowance that's levelled up to the fostering allowance that should be across the board no matter the legal order that families have. Thank you so much, everybody, to Paul, Lorraine, Vicky, Kelly for their contributions. As it's Kinship Care Week, I would like to end with a short video that celebrates kinship carers' vital role. We have over 70 responses of people that shared lovely messages thanking carers, their families, and people that have supported them along their kinship journeys. Thank you all for coming today and standing with us to get kinship care families the support they deserve.
In celebration of Kinship Care Week, I would like to send a big shout out to all kinship carers.
I want to say a special thank you to all those kinship carers who cared for those people who are now very dear to my life, and to all kinship carers out there.
For the early mornings, the school runs, the half-finished cups of tea, thank you. For the constant juggling, the daily hugs, the bedtime stories, thank you. For always making time when there just aren't enough hours in the day, thank you. And for always putting the needs of the ones you love above your own, thank you.